Anxiety and depression.
There's a loneliness epidemic.
Behavioral problems and addiction.
What we see is how they're so intertwined.
Mental illness wears many faces, spreading throughout our communities.
They can't relate to their neighbors.
Devouring our friends, families, and coworkers.
Feeling more isolated and suicidal.
And killing our will to live.
No one realizes they need it until they need it.
A continued spike in mental illness and resources that just can't keep up.
People are out of options.
Which is why things have to change.
The fact that mental health has really been a forgotten part of healthcare in America.
Tonight, Fox 43 is talking about the triggers.
I think every parent at this point knows the impacts of social media.
How's it going?
Having candid conversations.
Talking about it and having those open conversations with employees, because you never know what somebody's going through.
And helping to silence the stigma.
I think the most important thing people can do is normalize it themselves.
The state of mental health in Pennsylvania begins right now.
If you don't have a mental health infrastructure there, it's just a ticking time bomb.
It's a continuously building crisis in Pennsylvania and across the nation, the growing need for mental health care and the lack of mental health support. Thanks for joining us for this special edition of Fox 43 News, Silence the Stigma. I'm Amy Lutz. In honor of May's Mental Health Awareness Month, for the next 2 hours, we are going to be hearing from the people most impacted by mental illness and solutions on fixing what health experts call a growing crisis. First, we want to provide some insight into exactly how we got here when it comes to this mental health crisis. Anxiety and depression, as well as substance use disorder, are the most common mental illnesses with which Americans are struggling. More than 30% of adults say they have symptoms of anxiety and depression. That's according to the Kaiser Family Foundation. Meanwhile, 20% of young adults between the ages of 12 and 17 reported having a major depressive episode. The survey also shows drug overdose rates have increased by nearly 50% over a 2-year period. Those nationwide numbers are startling. However, what's happening right here in our own backyard? We talked with first responders and leaders in the mental health field to see where the state of Pennsylvania's mental health infrastructure currently stands. Pennsylvania is in a crisis, years in the making.
A lot of people are in somewhat of a denial that mental health affects their communities.
Nate Herrig has been with Cumberland Goodwill EMS in the Carlisle area for more than 20 years. He's well aware of the issues that have been plaguing Pennsylvania's healthcare system.
So a lot of people, when we encounter them in crisis, we take them to an emergency room, and they're held in that emergency room until they can find bed placement to kind of get them the psychological help that There's no beds in Pennsylvania, especially in this immediate area. So we're regularly driving to Clarion in Pennsylvania. We're regularly driving to Philadelphia area just because there is nothing locally that we can really provide for these patients who they just need a little bit of mental health counseling.
Leading up to the COVID pandemic, access to mental health care varied across demographics. Now, nearly 32% of adults report feeling symptoms of anxiety and depression, with about 23% saying they have unmet needs for counseling, according to the Kaiser Family Foundation. We talked to Herrig 2 years ago during the height of the pandemic about the lack of care, and this is what he had to say.
Here in Pennsylvania, we're beyond crisis. We're at neglect.
When asked how the situation is now 2 years later,
and it still hasn't gotten better. It's still, the stress of life just isn't being dealt with, and the pandemic really amplified it.
And when mental illness treatment needs go unmet.
When they are in the throes of a crisis, it can lead to, at best, an arrest and a criminal prosecution, and at worst, it can lead to a serious altercation.
Patients in the middle of a mental health crisis could at times run into law enforcement instead of EMS. That's why in York County, area leaders continue to build out the co-responder program.
We help people that are in an immediate or emergent crisis. They're either suicidal, homicidal, psychotic, have substance abuse issues.
Angie Alvarez was York County's first co-responder and helps police engage and work with people who are in a crisis. She has helped grow the program to several municipalities in the last 2 years.
I always call it being in survival mode. When you're out there on an actual scene and they're in the middle of the crisis, you just do what you need to do to help that person get through and make sure everyone's safe.
And York County officials say it's working.
Out of that 899 contacts, only 1% led to an arrest. Only 1% of individuals were arrested. That's highly successful.
The Co-Responder Program is a collaboration with WellSpan Health. It started with York County Regional Police and Spring Garden Township, and now has expanded to 11 police departments, including 2 in Adams County. Barker says the program isn't meant to replace law enforcement, but to help them better understand the community they're serving. The biggest need for the mental health community is more money to support the deteriorating infrastructure. Not only do state and area leaders see this need, but so do a lot of people within the local communities.
For every person who is not in this room, there are so many behind who can't get up out of bed. This week alone, I have spoken to 5 families who in the last couple weeks, their person, their child, has completed their life by suicide. That's in our community.
That's Andrea Katz, a chaplain with UPMC Carlisle and a Cumberland County resident. She's just one of dozens of people who showed up to several town halls hosted by Cumberland and Perry County leaders to push for more local mental health funding. They say there's been a steady decline in mental health funding allocations since 2009, and with such a continuously growing need, they now face a $2.5 million deficit for mental health services. Without immediate help, they say they'll be forced to cut vital mental health programs and services. Hoping to be the answer to those urgent calls for funding, Governor Josh Shapiro has suggested a significant boost to mental health funding in his first budget proposal. It includes $20 million to support county-based mental health funding this year, with increases each year to reach a $60 million per year increase by the 2027-2028 budget. The governor is also calling for $100 million each year for the next 5 years for schools. He says it is vital to ensure students and staff are properly connected to the right services and trained professionals.
So many of our schools are unequipped to handle student mental health needs, and our counties lack the resources to be there when Pennsylvanians need them most.
Other mental health priorities in Governor Shapiro's budget include a one-time $5 million allocation to support the state call centers that runs the 988 Suicide Prevention Lifeline. A state budget must be passed by June 30th. Access to mental health treatment continues to be a challenge for many Pennsylvanians, especially in rural areas. Farmers are particularly at risk. Fox 43's Marshall Keeley shares the alarming trends facing America's food producers and what's being done to curb the problem.
A farmer's job is never finished.
The demand just does not quit.
But their way of life is getting harder.
It's becoming very stressful even more as the years go on.
They're feeding, fueling, and fertilizing a nation despite increasing costs, environmental pressures, and scrutiny. Some are struggling to keep going, worried their generation will be the last. Still, on the farm, there's not a moment to waste.
Generally, a farmer is themselves and their family, and they've got work to get done. You have your routine, and you really just don't have time to sit around and talk.
And they tend to continue to go right on through doing their daily jobs, but forget about taking care of themselves.
I think everyone thinks of mental health as a weakness.
Ignoring the problem can prove costly.
I know that from being a child, I've heard of farmers, even committing suicide.
The most recent data compiled by the CDC outlines the issue. Tallies from the National Death Reporting System show the rate of farmer suicide in 2016 was among the highest of any occupation, with more than 43 suicides per 100,000 farmers. That's almost 30 points higher than the nation's overall suicide rate the same year. Farmers say the conversation is slowly changing as national and state farming organizations raise awareness. Nonprofit AgriSafe Network offers farmers what it calls question, persuade, refer training. The idea is farmers who are dealing with stress, anxiety, or depression will be more likely to listen to a familiar voice.
Give them a phone call. Say, how is it going today? I saw that you weren't out and about, and this is where we need to check up on each other.
It's easier than ever for farmers to find help right away. The state's Agri-Stress Helpline is available 24/7.
These are folks who are trained in agriculture. They're familiar with your stresses. They know your way of life. So you're getting a friend on the other end of the phone.
It really shouldn't be a stigma. Everyone goes through difficulties of different kinds, and if we all communicate about any topic, we can help one another and glean a little bit from each other.
Drought, flood, feast, or famine, advocates are ready to help farmers harvest hope. Marshall Keeley, Fox 43 News.
It's not just farmers. Work can cause extreme stress to people in all different types of industries.
Oftentimes it's easy to think I can compartmentalize work and I can compartmentalize my mental health and personal life, but that's not reality.
Mental health has been a top workforce concern for years. Coming up, hear how one South Central Pennsylvania company is helping its hundreds of employees stay on top of their mental well-being. Silence the Stigma, the state of mental health in Pennsylvania, will be back after a short break. Mental health is a top workforce concern across so many industries. According to the World Health Organization, approximately 12 billion workdays are lost every year to conditions like anxiety and depression. Fox 43's Alyssa Kratz highlights one Lancaster County employer that's working to increase mental health support for its workers.
How's it going?
Pretty good.
Yeah.
It's been a good week, yeah.
Every week, Michael Lewis walks in and out of the shops and cafes that make up Kitchen Kettle Village in Lancaster County.
So you're keeping really busy.
Yes, that work-life balance and all of that.
But he's not just a frequent customer. Mike is Kitchen Kettle's workforce advocate.
I am walking around building a relationship, just hearing about how people's day is going and being available if there's a need.
He also takes time to meet one-on-one with workers and managers. It's all part of a year-old partnership between the village and the Factory Ministries, a social services organization that focuses on alleviating poverty.
But we define poverty a little differently. It's a lack of resources. That could be financial, but it could be emotional or relational or physical as well.
According to a recent workplace mental health report from Lyra Health, 86% of U.S. workers have faced at least one mental health challenge in the past year, but only 33% say they've received support in that time. A lack of resources is exactly what the advocacy program is looking to fix for Kitchen Kettle's 300-some employees.
If somebody has an issue or wants to goal set and plan and achieve things, outside their professional world, but even personally, if we can help with that growth, that's a win for us.
Directors say having Mike here as a workforce advocate is more important than ever coming out of the COVID pandemic, which really isolated people and strained their ability to connect with others.
You're dealing with people all the time, and then if internally you feel a little disconnected, it makes it really hard.
The program helps employees open up about really anything, including their struggles, stresses, and goals for the future.
Oftentimes it's easy to think I can compartmentalize work and I can compartmentalize my mental health and personal life, but that's not reality.
In turn, allowing them to have better relationships with each other as well as with guests, something Kitchen Kettle believes benefits workers and helps the company retain employees too.
If we can make our employees happier, healthier, better at work, they're going to be better at their job. They're going to be spreading happiness.
Alyssa Kratz, Fox 43 News.
Of course, there are people who may not have access to employee assistance programs. Mental Health America of Lancaster County has its own community mental health assistance program. The program, known as CMAP, provides 3 free counseling sessions to Lancaster County residents who don't have access to an EAP. After the first 3 sessions, participants may be approved for additional 3 sessions at no costs. If not, Mental Health America of Lancaster County officials will help people set up the next best option. Well, social media impact. It is no secret social platforms online can have negative side effects on mental health. After the break, we dive into why and tell you how one Pennsylvania county is fighting back against big social media companies.
Casinos do this, we know that. You're going to put in $20 and you win $5 and you keep playing. Whether it's likes that pop up or just using the algorithms to see what are you focused the most on.
Compulsive habit forming, even addicting. Those are all words that Pennsylvania leaders and health experts say describe social media use in our society. A lot of people tend to fall prey to the inebriating tactics of social media companies in 2023, though one group in particular seems to be the most common victim. We dive into how social media has impacted one of the most vulnerable groups of people and the way one Pennsylvania county is fighting back.
There's definitely the dark side, like the bad side, where people behind their screens will comment anything.
20-year-old Robin from Chester County dealt with depression early in life, and she attributes part of that diagnosis to cyberbullying on social media.
Having had like such struggle with my mental health, getting like a negative comments, it would make me spiral. It was absolutely devastating.
Instagram, Snapchat, TikTok. 81% of teens and 69% of adults in the U.S. use some form of social media. That's according to the Pew Research Center. Health experts say the reinforcing nature of rewards, such as likes or comments, keep people coming back for more.
Can be habit forming or designed to be actually addicting.
The most common comparison is gambling.
It's very much like a slot machine. It's not predictable, and that actually reinforces you to do it more and more.
That's exactly why school districts and groups across the country are targeting social media companies. Here in Pennsylvania, Bucks County leaders filed a 109-page lawsuit earlier this year against the owners of some of the biggest platforms like Facebook, TikTok, and Snapchat. They argue those companies have targeted the country's most vulnerable population while comparing social media to a casino that fits in your pocket.
It's obviously a form of psychology that is manipulative, and they're using it to make money. We think it's irresponsible, especially when you know now the impact on young people especially younger people who are so impressionable.
The lawsuit claims youth mental health problems have advanced in lockstep with the growth of social media over the years. It accuses those companies of violating Pennsylvania's public nuisance law by creating a, quote, mental health crisis in the Bucks County community.
More than a third of our young people are having issues with depression and anxiety and negative self-image and suicidal ideation, and those things that are all higher than what our mental health staff has seen before.
The biggest hope for the outcome of the lawsuit:
to get them to change behavior. We want to use those things, but we want to know we're doing it in a safe manner. We don't want to be contributing to the problem.
While those who have felt the firsthand negative impact say there are upsides to an online presence.
I really believe that there is a positive side that can actually genuinely uplift people, and people talk about their struggles so people can understand oh, I'm not the only one going through this.
Robin not only shared her experiences with social media and battling depression, but seeking treatment as well. Sharing her story is just part of what we have coming up for you in the next hour and a half. Stay with us. This special edition of Fox 43 News, Silence the Stigma. We'll be right back. A lack of resources and an increase in need.
The number one problem that all people suffering from mental health illnesses in America today is access to quality care that is competent.
From anxiety, depression, to body insecurity and risky behavior.
So we've seen the increase in vaping.
All things the teen and young adult brain just isn't equipped to deal with.
We know the teen brain is not done developing. I think peer pressure has a huge role in it.
The second leading cause of death is suicide.
But new programs, resources, and increased awareness is making a difference.
The concept that youth suicide is prevalent or is an epidemic is a myth. Kids are not supposed to be dying, period.
It is one of the few things that I can say unequivocally has been successful.
Fox 43 is working to silence the stigma by changing the conversation from fear and denial.
It'll only work if they have that bond of trust between the patient and the provider.
To love and acceptance.
Getting help is okay. It's out there. You just have to, I think, accept it and accept that you might need it, and it's okay to need it.
No matter who you are, no matter what you look like, where you come from, it's important to feel connected to people.
Silence the Stigma Youth in Crisis begins right now.
Kids are not supposed to be dying, period, right?
Reese Butler is talking about one of the leading causes of death in children starting as young as 10, suicide. The creator of what's now the National Suicide Prevention Lifeline says that kids and teens around the nation are in the middle of a continuously growing crisis. Thank you for staying with us for this special edition of Fox 43 News, Silence the Stigma, Youth in Crisis. I'm Amy Lutz. We're going to be highlighting the biggest mental health issues facing one of the nation's most vulnerable populations. We introduced you to Robin in the last half hour, a 20-year-old from Pennsylvania who dealt with severe depression and anxiety for a majority of her teenage years. She opened up to us to tell us what dealing with the diagnosis was like before seeking treatment.
And I had been struggling a lot with my depression. And like I said, I realized that I was getting into more fights with friends and parents, and nothing was ever my fault in my head. But I think when I realized relationships starting to decline and it being harder to get out of bed.
Those are symptoms of depression that are easy to recognize in yourself or your loved ones. Like we've said, Robin has since received treatment. We'll share her story of recovery as well as life after in the next two parts of our Silence the Stigma special. Though no experience is exactly the same when dealing with a crisis. When school-aged kids are having a mental health issue, it can be confusing, to say the least. Sometimes they don't know who to reach out to for help, or even if what they're going through is worthy of intervention. Pennsylvania has an anonymous tool that aims to be the first line of defense, with the goal of keeping all students safe. Fox 43's Jackie DeTore finds out if the Safe to Say Something program is actually working.
Submitting tips is saving lives.
We know for a fact that we have prevented suicides of students.
Pennsylvania's Attorney General says the Safe to Say Something program has grown each year since the AG's office started it back in 2018. Students, parents, and teachers can submit anonymous tips about people who may be a threat to themselves or others. It started as a way to prevent a tragedy, like a school shooting.
I can say with confidence that we've absolutely stopped the violence.
Last year, there were more than 25,000 tips, with an already 250% increase this year. The highest number of reports comes from bullying.
The bullying really ties in with, potential harm. Maybe not today, maybe not next week, but maybe 2 months from now, if there isn't intervention.
Last year, more than 3,000 tips came from school districts right here in South Central Pennsylvania.
If you don't address those issues and you don't intervene, it can often lead to the kind of school violence that we're trying to prevent.
Once that tip is submitted, it's vetted by an analyst and then sent to someone trained to deal with the issue.
The reports that we've gotten back from the school districts have been, we would have not known that this student was suffering or in crisis or needed attention, but for the Safe to Say tip that either came in as a self-report or through a friend.
The Attorney General wants more money for the program because it's been so successful. She's asking for a 17% increase in funding in the state budget, hoping to hire 2 additional analysts and some technology upgrades. Jackie DeTore, Fox 43 News.
A Pennsylvania lawmaker wants to give students a break if they're experiencing mental health issues. Montgomery County State Representative Napoleon Nelson says he plans on introducing legislation to allow 3 excused absences for mental health reasons without a doctor's note. As of now, 12 states consider mental health days excused absences. Lawmakers have previously proposed similar legislation in the last few years, though those bills stalled in the legislature. It is no secret that being a teenager is rough. However, growing up is now harder than ever, especially on teen girls. That's why if you have teenagers, health experts say it is so important for you to start the conversation about mental health early.
It's hard to develop a sense of self when the reality that you're comparing it to is not actually real and often filtered.
Figuring out who you are is a big part of the teenage years, but in this age of social media, it's much more of a challenge. A recent study from the CDC showed alarming statistics about the declining mental health of teen girls. Nearly 3 out of every 5 teen girls felt persistently sad or hopeless in 2021. That's almost 60% more than in 2011. So what is behind this drastic increase?
We've seen this with teen girls increase in depression, anxiety, and the alarming thing is suicidality. And part of that is they are on social media, they are on their cell phones, they're connecting with other kids, but it's a very different connection than in-person communication. And that is leading to more isolation and loneliness.
So what do we do if we're worried about our girls and want to support them? Experts say talk to them and find ways to connect with them by doing whatever they like doing. Then listen. When there is silence, it's okay. They may need more time to open up, but when they talk, resist the urge to talk and listen instead.
Sometimes I think just focus on connection without talking. You may be annoying to them, but ask them to play, take them out to a place that they like to eat. Start off non-confrontational, not focusing on the issue, but just establishing the connection with them. When you see a window, when they start to talk, put whatever you're doing down and listen.
Be empathetic. Be honest with them and share your struggles. Let your teen know you feel sad and depressed sometimes too. Help them evaluate how they use social media and how they feel during and after using their phones.
You can ask them questions like, how do you feel when you get off this social media app, Snapchat, Instagram, whatever it might be? What are you seeing on there? Are you connecting with real friends or people you don't really know? You have to give them the tools to be able to navigate it.
An especially alarming growing trend among teens and kids is increasing use of nicotine vapes and drugs. Studies show deaths due to drug overdoses among adolescents nearly doubled from 2019 to 2020. Researchers with the Kaiser Family Foundation say those deaths are largely attributed to the rise in fentanyl-laced substances like vapes. And it's right here in South Central Pennsylvania. A high school student had to be revived with Narcan earlier this year. That student overdosed in the Redland High School cafeteria in early March of this year. The student was fortunately able to be revived by 2 doses of Narcan. They were administered by school nurses. Doctors with UPMC say this is becoming more and more common across the region.
It's not difficult at all to add fentanyl to a vape solution. So it's, unless you're getting your vape solution from a reliable source in a sealed container, the reality is you just have no idea what it is that you're using.
While West Shore School District officials did not specifically say what the student overdosed on, the superintendent says on occasion, vaping substances being used by students are laced with fentanyl with or without the student's knowledge. As more students turn to different substances, there's a question as to why. 2 health organizations are currently working with York City School District to address the concerning trend of kids vaping. In some cases, it's children as young as 10 years old, and experts say it is directly tied to mental health.
The rise in youth use of those vaping products is a serious issue, not just in this area, but across the country.
York County health officials are warning families about a serious trend spreading among kids and teens. Both York City School District and Family First Health Center administrators say the rise in vaping among younger age groups is directly tied to mental health.
With mental health issues that are maybe not being handled appropriately, students are outletting to something that's not healthy, whether it be vaping or another, risky behavior.
2019 data from the U.S. Substance Abuse and Mental Health Services Administration shows more than 5 million high school-age students reported vaping nicotine in the past 30 days. Nicole Tome, the school-based health center manager with Family First at Hannah-Penn, says this kind of behavior can cause serious long-term issues.
Introducing any type of chemical to the brain that really shouldn't be there, like nicotine, can set a person up for an addiction with that chemical or potentially others, that are even worse. So the fact that they're more willing to try it, but also not recognizing its connection to a lifetime addiction.
That's why Family First has teamed up with nonprofit the Burns Health Education Center to bring information about the dangers of vaping directly to York students. They recently visited classrooms with students in the 5th and 6th grades.
You can have substance abuse conversations as early as pre-K and kindergarten. It can start with conversations around medications, how to take them the right way. Sometimes doing education, especially on substance use at a young age, is uncomfortable. But doing it in an age-appropriate way is so valuable because that allows students to have that knowledge before they make those decisions.
And even if there isn't school-based intervention,
I think it's really important for parents to be open and honest. And if parents don't have that kind of factual information, I would say it's okay to say that and to reference out, maybe look at websites together to find the facts.
we have more information on both health organizations as well as how vaping affects kids and teens on our website, fox43.com. There are plenty of stressors for kids. What about adding extracurriculars into the mix? Student athletes in South Central Pennsylvania are stepping up to face the hidden opponent like a rival team.
It's really incredible to see how many people are willing to get involved in this mission and willing to support it.
Area colleges and universities are just a few of the hundreds of schools worldwide teaming up with a nonprofit called The Hidden Opponent. Coming up, how they are working to bring awareness to mental health on and off the field. There's only 24 hours in a day. When you subtract 8 hours of sleep, going to class, studying, homework, practice, and eating 3 meals, the day seems so much shorter. Mental health can affect anyone, even people who seem like they have it all together, like those student athletes. Fox 43's Lindsay Barta catches up with 2 Millersville University student athletes trying to end the stigma by teaming up with a world-renowned nonprofit.
There's an opponent that student athletes face that isn't visible to the naked eye. It follows them wherever they go. That opponent is mental health.
I feel like I've always known it was a serious issue because I grew up being an athlete, but when I was growing up, I feel like I would just brush my emotions to the side.
The NCAA did a study last year on mental exhaustion, anxiety, and depression, and they are 1.5 to 2 times higher in student athletes since before the COVID-19 pandemic. Mental health is a serious issue around campus, and instead of ignoring it, student athletes at Millersville University face it like a rival team.
Whenever I got injured, my mental health tended to spiral, and in high school I didn't really seek out the supports that I did in college. So I wanted to sort of propel that sort of support forward and almost pay it forward to the people who helped me get through all my struggles.
They're paying it forward by teaming up with a nonprofit called The Hidden Opponent, becoming campus captains to bring awareness to mental health issues and the stigma surrounding them. Maya Parekha and Jenna Dombrowski might play different sports, but they're on the same team when it comes to teaching fellow student athletes about mental health. They host an hour-long session once a month to advocate, educate, and support one another.
Having this program will normalize the conversation, so the people that are a little more fearful to talk about it can really use their voice.
Knowing how to balance everything can be hard.
You got it down where it's like, no, it's actually kind of a lot when you break it down and look at like, okay, I have this much time to do homework, I have to practice at this time, I have class at this time, I also have to eat, and then I have to get 8 hours of sleep, and it just all builds up to just one ball on fire.
And the sessions can be eye-opening.
I think it opens up a lot of doors. It's easy to say that, but it's another thing to actually see it. So these meetings kind of help with that a lot.
It means a lot actually to see, especially other athletes that can relate. And then it's student athletes themselves putting on the meetings. So it kind of shows a lot that everyone does struggle and that everyone deserves to get help.
They're bringing the fight to the playing field. A Marauder baseball player saw the Hidden Opponent Millersville page and reached out to bring awareness at a game. Not just talking to students, but also informing fans. It's one conversation that can lead to another to help save a life.
I hope it means that we won't lose another person. While there's no guaranteeing it, I think that spreading the word and having these meetings is one way to show people that there is help out there.
The Hidden Opponent has reached more than 500 campuses across the world. 42 colleges, universities, and sprinkled with a few high schools are raising awareness in the Keystone State. E-Town, Franklin and Marshall, Gettysburg, Shippensburg, and including the Ville have all campus captains that hope to turn the page against mental health.
It's really incredible to see how many people are willing to get involved in this mission mission and willing to support it, coaches, fans, players, and just really all types of people. We like to say we're a community for anyone who's at all involved in the sports world or even just sports fans.
Lindsay Barna, Fox 43.
Anxiety disorders are a stigmatized condition affecting nearly 40 million Americans. Normalizing the conversation is just one way to help those affected. A federal panel is proposing adults under 65 be screened for anxiety, though, as Ron Jones explains, defining it is just one step in the journey for mental wellness.
I was a very happy, jovial center of attention. And what I saw was, and my family saw, was a shift in personality.
In social situations, we get very overwhelmed and very panicky.
Anxiety gives us that arousal, that extra oomph to get things done. Many people who have excessive anxiety, they can't function as they would want to.
More than 3 million adults reporting severe symptoms are not in treatment.
I fall into that pattern of trying to white knuckle it and get through it.
I'd start asking, all the intrusive thoughts come back with, why did this happen? Because I basically lost my military career after 24 years.
A health task force is now recommending all adults under 65 be screened for anxiety.
Anxiety is associated with a number of other problems, such as substance use disorders. It will only better society and behoove us to be able to screen and treat more people.
Anxiety disorders fall under 5 major categories.
It manifests itself in the physical form 100%. My heart will start beating out of my chest. It's just the feeling of being numb.
Being diagnosed can stir up different emotions.
I felt like a second-rate human.
It was comforting for me, honestly, because again, it did have a label.
A lot of people will say, I'm strong, I can handle it. It doesn't have to be that hard. Life is hard anyway.
I also experienced shame and feelings of unworthiness or weakness.
Well, you can catch the full Anxiety Nation series on Fox 43 Plus. That's available for Roku and Amazon Fire TV. So far, we have talked about normalizing the conversation around mental health with teens. But what if that conversation is with a child? After the break, we'll find out how to get the discussion started and when it may be time to get help from an expert. When it comes to mental health, a lot of focus has been placed on normalizing the conversation. But what if that conversation is between a parent and a child? Fox 43's Sean Stryker sits down with a professional to find out how to get that discussion started, some warning signs that something might be wrong, and when it's time to seek the help of an expert.
For parents, there's no shortage of things to worry about when it comes to our children. Are they sick? Are they hurt? How are they feeling? Some of these questions may be easier to get answers to than others.
Why is it easier to talk about, pains in our legs or pains in our ears or a toothache, but yet we can't really talk about like being sad and not feeling, safe at school or feeling, worried all the time.
Joelle Jones is a licensed clinical social worker at UPMC Children's Community Pediatrics in Camp Hill. She says the responsibility to make that conversation comfortable rests on parents. And the earlier you start, the better.
The younger they are, the less they're going to be even aware that, there is a societal difference between physical and mental illness.
Getting the discussion started with older kids can prove more difficult, which is why Jones stresses the importance of listening.
I think that the more casual that you're able to make it and the more that you're showing that you're interested, that you're prepared to do active listening rather than, trying to change how they feel, the better.
Sometimes, no matter how approachable a parent is, a child might prefer talking to someone else, like an aunt, uncle, coach, or teacher.
It may be nothing you're doing as a parent, absolutely nothing, and you can't point to any reason why they're, just uncomfortable talking to you. That's okay. It's not something that you need to beat yourself up about at all.
Even if you're not the one they choose to talk to, there are a few things you should be on the lookout for.
If you see an impact to appetite, sleep, and if you see just a lot of behavioral change across environments, that's probably the best indicator that you need to consider whether or not something more might be going on.
And if you see something that concerns you, bring it to a professional.
Bring it to your pediatrician. Bring it to an outside source, an objective source, who can really use, validated assessments, standardized assessments, to see if that is really outside the norm for their developmental stage.
Now, Jones says even a pediatrician can help answer questions and address concerns. They might even be able to catch something a parent misses, which is another reason why annual checkups are so important. Putting your family first, Sean Stryker, Fox 43.
And the main point we have stressed throughout this last half hour is having those open conversations with kids and teens about mental health issues. The less they're afraid to talk about things, the more likely they are to receive the help they need. Stay with us. Silence the Stigma. We'll be right back.
There were so many moments where I knew I needed help.
Because I felt confused and like my life was spiraling out of control, I was doing whatever I could to try to feel some sense of control or safety.
All of the uncomfortability that I experienced as a kid and washed it away. The more I drank, the more it washed away.
Desperate for a diagnosis, but afraid to take the steps.
There's stigma of people with mental illness, but there's also stigma of receiving treatment.
You're kind of looked down upon societally.
The truth about mental illness.
This is a chronic illness.
From the perspective of those succeeding and struggling every day.
We can't stop other people from seeing us as they choose to see us.
Fox 43 explores the difference a diagnosis can make.
There's no shame in seeking help for mental illness, none.
The importance of lifelong support.
The individuals who are struggling are not bad people. We're just people who need help.
And what still needs to happen to truly silence the stigma.
My greatest hope at this moment is that we realize, as important as awareness is, that awareness is not our solution. My hope is that we have the courage to experiment and the mercy to allow people to try more than once.
Fox 43 is silencing the stigma and understanding the diagnosis. Thank you for staying with us for this special edition of Fox 43 News, Silence the Stigma. In Understanding the Diagnosis, the third part in our 4-part Mental Health Awareness Month special, we aim to better understand exactly what those with mental illness are truly feeling. In these monitors are people who have experienced the highest of highs and the lowest of lows of their diagnoses. One you may recognize as one of Pennsylvania's U.S. Senators and former Lieutenant Governor John Fetterman. The other two are just members of the South Central Pennsylvania community looking to make a difference by sharing their story. Right now, we are diving into their individual stories of their dealing with mental illness and their life after treatment. As we mentioned, Senator John Fetterman has publicly shared his struggle with depression. Fox 43's Harry Lee explains why his disclosure is still rare among elected officials and could even help lessen the stigma surrounding mental health treatment.
Senator John Fetterman said in a recent interview with MSNBC's Joe Scarborough that he's begging anyone struggling with their mental health to get treatment.
And he did say treatment works.
The remarks come a month after Fetterman was discharged from a 6-week stay at Walter Reed National Military Medical Center in Bethesda, Maryland. His admission there for clinical depression in February set off a national discussion about mental health.
There's no shame in seeking help for mental illness, none. And I think that was the message that came out from his admission to the facility.
That message still has not reached everyone in society.
When people think about asking for help, oftentimes they think, oh, people are going to judge me, especially in middle-aged white males.
White males account for nearly 70% of suicide deaths, according to the American Foundation for Suicide Prevention.
They feel like there might be judgment against them, that they're weak or they can't cope.
Health experts say that may be one of the reasons Fetterman did not seek help sooner.
Fetterman shared that he didn't know his symptoms were attributed to depression, and we see that a lot.
Fetterman's health was already under scrutiny after he suffered a stroke on the campaign trail. Voters still appeared to endorse his fitness for office, though, by electing him to the Senate.
Congratulations, Senators.
Mental health advocates say his mental illness should not be treated any differently than his physical illness.
They're clearly integrated, and I don't think can be treated separately.
Whether physical or mental, treatment is the key.
Fighting stigma and extinguishing stigma is a long-term goal because it stops people from seeking treatment. He probably has no idea how much good he did by being public.
Advocates say Fetterman's high profile could inspire others struggling with their mental health to get treatment.
I'm hoping that by Fetterman coming forward, he will use this platform to promote mental health and treatment, and I think that's significant.
Senator Fetterman's team declined to comment for this story. Harry Lee, Fox 43 News.
As we have stressed before, access to mental health treatment is one of the biggest issues facing America's healthcare system right now. However, even with access to treatment, those with a diagnosis may be afraid to take the first step towards treatment for multiple reasons, whether it's discomfort with a provider or frightened feelings over the stigma of receiving treatment.
Finding an auto mechanic that you trust to repair your car is difficult, right? The barriers to finding somebody that is a mental health professional that you trust, that you'll open up your heart and soul, the deepest, darkest secrets to, that's a pretty tough hill to climb.
Reese Butler, the creator of what's now known as the National Suicide Prevention Lifeline, says that while not all mental illnesses are created equal, they're oftentimes treated that way. Insurance companies tend to put a cap on the amount of visits covered to a counselor or therapist. He says there's a step people can take in order to help out a family, friend, or coworker in need.
Anyone can learn a basic gatekeeper training program like QPR, question, persuade, refer. It takes 1 hour. It can be done for free or maximum $29 online. Many people know CPR and never get to use it. I guarantee anybody who's willing to spend 45 minutes and learn QPR, they will get to use it.
Butler stresses QPR is not a replacement for treatment, but it is a resource anyone can use in a pinch to help someone who may be facing a mental health crisis. Life before receiving treatment can be difficult. And really, not only is each illness itself different, everyone's individual experience with the illness is as well. So tonight, we are introducing you to community members diagnosed with mental illnesses who have worked their way out of that darkness. Louis Bianco has been struggling with his mental health since he was 15 years old and was diagnosed with bipolar disorder. Christopher Dreisbach has been on a path he says led him to addiction since he was just 13 years old. Both of these incredible men sat down with me to tell us what life was like before they got help.
It's sensitive. Out of the rest of my siblings, my feelings were hurt more easily. I would cry more often. I would say medication started when I was hospitalized for the first time my junior year. So that would have been around 2000, 2001. I was receiving things like therapy and outpatient treatment. When the 9th grade piece started, I was in the guidance counselor's office a lot, but once I had what I would call my first episode, that's when the medication started, and I started to go into the lockdown psychiatric facilities, and everything really started to plummet.
So my experience with addiction started when I was 13 years old, and I went to a family wedding, and I saw a lot of the adults drinking and having a good time, and I also kind of was 13 years old and very large and growing facial hair, and I kind of went up to that open bar and I started drinking. And what happened for me was it took all of the uncomfortability that I experienced as a kid and washed it away. And from 13 on, I really constantly chased that feeling, and I had to move on to the next level of substances and the next level of substances and the next level of substances until I landed on heroin at 17, and that took me way, way, way off course.
They had so many, before we really nailed it down to bipolar and PTSD, they said I had traits of obsessive compulsive disorder. It was at one point major depressive disorder and generalized anxiety disorder. They saw borderline personality disorder. I was manipulative. In the mental health field, there's somewhat of a hesitancy to diagnose something like bipolar at that early of an age.
There were so many moments where I knew I needed help, but I was unable to muster the brain capacity to make it happen, because addiction, substance use disorder, whatever you want to call it, is a brain illness, and it creates a neural pathway that blocks my ability to reason. So even though I know inherently I have a terrible, terrible issue, something that's really damaging my life in so many ways, I can't physically, emotionally, in any way handle that or push myself towards recovery, because I believe that this is my reality and this is the only thing that I'm going to deal with for the rest of my life.
There was a number of years early on where I somewhat expected it to go away. And in that expectation, every time it returned, there would be disappointment, high levels of disappointment. And in that disappointment, there would be dysfunction, and I would falter again and fail.
That's just the beginning of Chris and Lewis's stories. Still to come, they open up about their time receiving treatment, as well as what life is like now living with their diagnoses. Stay with us. Silence the Stigma. We'll be right back. The step people struggling with a mental illness find daunting and sometimes even terrifying is admitting that they need help. Even if the resources are there and available, taking that first step to get treatment can be difficult. Chris and Lewis shared their experiences about getting the help they needed, even in unexpected ways, and their views on the stigmas attached to it.
When I was first hospitalized, my roommate was a 40-year-old who was receiving electric shock therapy. So there wasn't a teenage unit or a child and adolescent unit. Now we found one, but locally there wasn't initially. I was the only teenager on that unit. There were also some requirements and duties that I had to fulfill as a patient in order to have visitors. And because it was my first time being medicated, I wasn't always able to get the amount of points I needed, so then I also didn't get the familial support and get visitors.
The first time that I went to treatment when I was probably 18 years old, so the county of Lehigh paid for me to go to an old state hospital in Wernersville, Pennsylvania, with some very antiquated models of recovery. And by the time I got in, I didn't want to get clean at all, and it just turned pretty disastrous. And all the rest of my treatment experiences were through the criminal justice system, because unfortunately, I continually ran afoul of the criminal justice system. When I was 18 years old, I got charged with felony burglary and criminal trespass because I walked into another person's house and took a needle.
But I'm 39 and I've had electric shock therapy, and I don't remember the majority of my life. And now here I am looking in the mirror, seeing a person that I wonder, like, how did I get here? So it's hope that continues to push me forward. It's something, it's hard to describe because it's abstract. And we want direct answers, we want concrete answers, we want the 30-day fix, we want the medication that works immediately. But if we go back to the concept that this process is so long, hope is literally that thread that keeps us hanging on during the moments of distress.
You're kind of looked down upon societally as a drug addict, if you will. And that's, neither here nor there. It just kind of is what it is. I was unable to maintain sobriety outside of jail, so my parole officer would repeatedly take me back to jail, and when I would get back out of jail, they would try their best to get me into another treatment facility, and on and on and on. It was a constant failure for me until finally a judge shipped me here to Lancaster County, where I was able to get involved with some support systems and local AA meetings, and I met a group of people who showed me a different way to live, which I haven't let go of in the last 16 years.
The stigma of being somebody with a mental illness, one of the major things I have learned and that I try to encourage others is that we can't stop other people from seeing us as they choose to see us.
We've also been telling you about Robin, a now 20-year-old who dealt with severe depression and anxiety for most of her teenage years. She told us about the moments she decided to start seeking treatment for her mental health issues.
I wasn't proud of who I was anymore. I wasn't the daughter that I used to be. I wasn't the friend that I used to be. I would look in the mirror and I didn't even see myself. I think when I realized relationships starting to decline and it being harder to get out of bed, that all played into it, definitely. And that's when my mom and I started researching Newport.
Robin says she ended up going to a Newport healthcare facility for a 3-month inpatient treatment program. Newport offers several types of treatment, from residential to outpatient. Officials with the healthcare network say not every case of treatment is as intense as Robin's. However, Robin says while she was scared to ask for help, she was even more excited for the outcome.
I'd said I was really scared, but I remembered walking through the doors and I was like, oh my gosh, I cannot wait to be the person that walks out of those doors in 3 months. And when that time came, it was the most unbelievable feeling in the world. I had felt more myself than I had in years.
Robin says if it wasn't for the caring nature of the staff at Newport, her recovery would not have been as easy. Newport not only has treatment programs for depression and anxiety, they also offer help with eating disorders and addiction. While those stories of receiving treatment are very personal, they're all too real for people dealing with a mental illness. However, there is power in asking for help and hope for a better future. Still ahead, we hear how life is post-treatment for Chris, Lewis, and Robin. Plus,
I couldn't separate from the monster long enough that I could calm down long enough. I want him to be controlled.
anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults every year. However, only about 37% of those suffering receive treatment. Right now on Fox 43 Plus, the 3-part Anxiety Nation series takes an in-depth look at an illness and why so many avoid seeking treatment for it. Again, you can catch that right now on the Fox 43 Plus for Roku and Amazon Fire devices. Silence the Stigma. We'll be right back. Once someone is diagnosed with a mental illness, the reality is they live with it forever in one way or another. Chris and Lewis share what life is like now as they move forward each day knowing that, with the hopes of letting others know they're never alone.
And, I think it was probably the weirdest part was crossing over. I probably used drugs and alcohol for 7 or 8 years of my life. And when I crossed that threshold past that, I think it was one of those kind of defining moments where, I already knew this was my life path, but I really felt it.
I've lost jobs, I've lost relationships. Sometimes it's been my own doing, sometimes it's because of preconceived notions. I appear too healthy to be ill, or I appear too ill to be healthy. And the perceptions of others, I'm at the mercy of it. But if I stop and say that's not fair, then the only progress I'm halting is my own.
I would say maintaining sobriety is not difficult every single day. If you feel like it's difficult every single day, look into some other programs, look into some other resources, look into some other supports, because recovery is not meant to be a doldrum, sad struggle and fight. Recovery is empowering. Recovery is strength. Recovery is power. Recovery is being able to walk amongst everybody else and feel like you belong.
My greatest hope at this moment is that we realize, as important as awareness is, that awareness is not our solution. I often compare it to the scientific method. As a nurse, we recognize a problem, so we start there, absolutely. Then we hypothesize what could be the answer. We take educated guesses, and at some point we have to start experimenting. And those experiments will succeed or fail, and if they fail, then we document what went wrong, what went right, and then we experiment again. So my books, for example, and the different music that I've written, all these different creative endeavors and speaking engagements, some of them succeed and some of them fail. but my hopes are that we start to experiment.
And the value of being able to help other people achieve sobriety and achieve a life that they really want to live is so multiplicative. There's really so many different factors that go into it. I mean, number one, every single time you help somebody, it inherently helps everybody around them, which makes the world a better place. So I like doing that. Not only that, but it helps me. I feel tremendous when I get to watch somebody go from eating out of a dumpster to having their own business.
Robin also has a message for anyone who may be struggling to take the first steps towards seeking treatment. She says her life drastically changed after those 3 months at Newport.
I know a lot of people before they go into treatment, they think, oh, I don't have time for that. Like, I have other priorities. But I really think that there's nothing more important than getting that help for yourself. Because really, when you take a step to the side and you look at the future, you have so many experiences yet to be had, so many people that you haven't loved yet, that haven't loved you yet, that you haven't even met yet, places that you haven't gone.
Thanks to her treatment at Newport, Robin is currently serving with AmeriCorps in Colorado and will be pursuing a bachelor's degree at Penn State in the fall. Thank you for joining us for Silence the Stigma, Understanding the Diagnosis. While we know we can't change everyone's perceptions, we hope this has at least helped people better understand more common mental illnesses. And if you or someone you know is struggling with depression or suicidal thoughts, dial 988 or text 741-741. If you or a loved one is potentially dealing with an illness and are curious about treatment options, we have information available right now on our website, fox43.com. Be sure to stay tuned for the fourth and final part of our Silence the Stigma Mental Health Awareness Month special, Hope in Treatment. It highlights both up-and-coming as well as common treatments for the mental illnesses we just talked about. We'll also take you to several businesses Chris helped get off the ground in order to help people recovering from substance use disorder get back on their feet. That's all coming up right after the break.
It's hell, it really is. And to not know where to turn, it's hard.
Feeling desperate and out of options.
I have been dealing with depression since I was 11.
I feel like it's a daily struggle.
Growing mental health issues continue to plague the South Central Pennsylvania community.
You want to know that you're not wrong for feeling the way you do.
With community members thinking there's no light at the end of the tunnel.
They've tried treatments, they've tried therapy, they've tried medications that just don't work for them.
However, there is always hope.
It's been really beneficial to have a work environment that is cohesive with recovery lifestyle.
Hope in support.
Fitness saved my life, and I just wanted to pay it forward.
Hope in community.
I think the biggest thing is changing from a sense of isolation and a sense of I'm carrying my problems myself to understanding that this is a location where they can come and freely express and get a handle on the issues that are bothering them.
Fox 43 is silencing the stigma and finding hope in the treatment.
So the biggest struggle that we've seen is people that believe, sadly, that their mental health crisis is unique.
Nate Herrig with Cumberland Goodwill EMS continues to stress that the two biggest issues facing the mental health community are the stigma attached to seeking treatment and the lack of resources put into Pennsylvania's mental health infrastructure. Thanks for staying with us for our Silence the Stigma special, Hope in Treatment. I'm Amy Lutz. We started the special by focusing on those issues. Now we are ending by looking at them from a different light, with the hope of showing members of the South Central Pennsylvania community new or unique solutions to the mental health crisis they may be experiencing, and to know they are never alone. Depression affects millions of people in the U.S. It can be so severe, it becomes life-threatening. A newer, non-invasive treatment called TMS therapy is now offering hope for people who suffer. I looked into how it works and talked with a patient about how it helped her get her life back. The tapping of this machine has the power to tap into someone's brain to treat depression. Just ask 25-year-old Sierra Johnson.
I have been dealing with depression since I was 11, and I was officially diagnosed with it when I was 12. I felt very lonely. I was ashamed of the depression. I felt really sheltered, and I just wanted to keep myself isolated from everyone and everything as a kid.
After years of trying medications with no success, she heard about TMS.
When they first described it to me, I was like, this sounds so scary. But it's really not, because you're sitting in a chair, you're not strapped to the chair, there's no intimidating room, it's very comfortable.
The FDA approved transcranial magnetic stimulation, or TMS, in 2008 for the treatment of severe depression.
It's good for people that have usually tried antidepressants and have not been successful with them.
Dr. Ken Rogers says a magnetic pulse stimulates brain tissue that's underperforming. In other words, brain cells that have been sleeping are awakened, which in turn boosts chemicals that are deficient in the brain, like serotonin or dopamine.
And so the goal is that over time, those areas being stimulated more allows the depression to actually lift.
Patients go 5 days a week for sessions that are less than 20 minutes, and thanks to minimal side effects, they can even drive themselves.
You do that for, several weeks, and then you're usually feeling better about 83% of the time.
Something Sierra definitely experienced.
My attitude has improved. My relationships have improved. My sleep has improved. I'm more in touch with my emotions,
allowing her to tap into a whole new world of freedom.
I'm able to go out in public in big crowds and not be nervous. I'm able to actually enjoy daily activities. So it's really improved my life, and I never thought it would, but it did.
Most insurances do cover TMS treatment, but for more information, I've put a link to WellSpan on our website, fox43.com. Well, there are different ways people are doing their part to try and erase the stigma around mental illnesses. As Fox 43's Lindsay Barna explains, one similar story has two men in Central PA teaming up to take action in two different ways.
This is my way to put more boots on the ground, have a facility where we can have basically a resource center.
Cal's Hope is a new mental health resource center in Mount Holly Springs, Cumberland County. Milton Dennis recently opened the facility. It provides support groups, a podcast for survivors of suicide loss to tell their story, but also tell their story of hope. Dennis says Cal's Hope provides people in need a voice that may not have one.
When I started talking about suicide loss and sharing my story, I seen what it meant to other people. And I was told at one time, don't stop telling your story. And what you said the other day saved my life.
This place holds a lot of meaning for Dennis. He and his family suffered not one but multiple losses to suicide. Having Cal's Hope on a sign and having a resource center means more than words can explain.
I can pay some tribute to the life I've never had with my father. I can pay some tribute to the life that I did not have or continue with my brother. And to have them still be part of this, and so many components of myself and them live on and live into the lives of others and help educate others, it's unimaginable.
And having that sign actually brings Dennis and a Central PA Legends driver, Richie Dobson, together. Dennis contacted Dobson's place of work to design a sign. The two connected and shared their stories, and now will be teaming up to spread the word around the mid-state.
The comfort level to speak to somebody that fully understands exactly what you're going through is like no other. I always say it's an unfortunate thing to have in common, but at the same time, it's a blessing in disguise.
This is Dobson's 5th consecutive year racing for suicide awareness after losing his father 27 years ago.
I don't want somebody to go through what we go through.
He wants to be the reason to save another life, and last year, just seeing the trailer on the highway helped one life.
We had a lady that followed our trailer. We were on the way to race at Clinton County. She messaged our racing page and said that she loved the trailer. And we met her for the first time at the Harrisburg Out of the Darkness walk. And she told us that she was going to take her life. And she turned around and went home because she saw our trailer.
It didn't even take a conversation, just seeing the special wrap. The message is, it's okay to not be okay. According to the National Institute of Health, around 8 million people will die from mental health disorders, a terrifying statistic that Dennis and Dobson are trying to erase. Lindsay Barna, Fox 43.
A major development this year in the battle against substance use disorder. The FDA has approved the opioid overdose reversal drug Narcan to be sold over the counter without a prescription. Opioid overdose deaths have skyrocketed in recent years, killing more than 100,000 people in 2021 alone. That's according to the National Institute on Drug Abuse. Addiction specialists say greater access to Narcan will save some of those lives.
I think we're universally in favor of it. It's certainly increasing access to naloxone will help to reduce stigma.
Emergent Biosolutions, the company that makes Narcan, says it hopes to make the nasal spray available in stores by late summer. The over-the-counter version will be packaged in a larger box with detailed instructions. However, cost could remain a barrier, with an average expected price of $130. They are underserved, underestimated, and often under significant financial stress. People battling a substance use disorder can wind up behind bars, making the road to recovery even more challenging. But as Fox 43's Marshall Keeley shows us, a recovery center owner and entrepreneur in Lancaster County is building businesses that are rebuilding lives.
Chris Dreisbach is a big man with a big heart. Now the CEO of Blueprints for Addiction Recovery, his path to success was anything but direct. After struggling with substance use and spending time in jail, he came to Lancaster County with a vision, soon starting a recovery center. In his eyes, it was just the beginning.
We started a painting and construction company to help give those guys opportunity and give them purpose. And that sort of led me to really love opening businesses and helping investing in people.
One of those people is Joe McDonald.
Coming out of state prison in, I think it was 2012, mid-2012, I wasn't sure what I was going to do.
Now a trained chef, McDonald says his first job was at Burger King, an opportunity he was grateful for. It led him to a brewery and then to Chris, who partnered with Joe to take over Doughhead's Stuffed Waffles. He's also in charge at the Honeybee Cafe, serving up breakfast sandwiches and coffee. McDonald says the stigma around addiction and incarceration still keeps hardworking people from good opportunities, like the one he found.
Even on my worst days here is better than, my best days when I was in prison and when I was out using.
Doughheads is expanding, opening a stand inside Southern Market in Lancaster earlier this year. It's where we met manager AJ Christensen, who says he's in recovery from fentanyl and heroin use. Christensen attended Dreisbach's Recovery Center after serving time for a drug conviction. He says his job keeps him going and keeps him focused on recovery.
Having a safe and positive workplace to come to is really important, because I don't have to hide what I've done, what I've been through, where I've been with anyone that I work with, and they're super supportive.
My outlet was mainly alcohol, and that was my best friend for a very long time. And then I was like, we're not very good together.
Zach Walter has a steady hand, and he has to. He's been tattooing for almost 2 decades.
This guy's new.
At SO Art Center, a new location in Lancaster, he finally has his own space. It's a place for collaboration, he says, a chance for local artists to showcase their talents and sell their artwork.
People every day come in here and tell us how much they enjoy being here.
Walter enjoys it too, saying there's a level of understanding between he and his co-workers. Dreisbach admits art isn't his forte, but he's happy to help a new community of creators find a place to establish themselves. He estimates 80% of the people he employs endured the same struggles he once did. He's out to give them all a second chance.
There are still so many people societally who are struggling with that stigma that we need to get louder, and be everywhere.
Marshall Keeley, Fox 43 News.
Animals alleviating pain in Lancaster County.
The ability of horses to sense all kinds of emotions is where you start, and becoming accustomed to that, the veteran becoming accustomed to that and interacting with the horse over time is very therapeutic.
After the break, how a local organization is helping our country's bravest heal from mental health issues with a little help from horses. Local nonprofits in South Central Pennsylvania are working to make a difference for the mental health community. Fox 43's Gabrielle Mediak tells us how the Building Bridges Foundation in Lancaster County is helping veterans heal through horse therapy.
Lovely. Come here. Come on. And he took his head and laid it right across my shoulder and had his head right up against my head, and it was just a neat experience. Like he was just saying, oh, how you doing, buddy? Sometimes the horse picks you, I think. Yeah, they're just neat animals.
Vietnam veteran Larry Russell carries the weight of that war with him.
Good boy.
While it's difficult for him to talk about, these horses are making it easier.
The ability of horses to sense all kinds of emotions is where you start, and becoming accustomed to that, the veteran becoming accustomed to that and interacting with the horse over time is very therapeutic.
Being with the horses, the presence of them being there and them actually coming up to me and allowing me to, touch them and so forth, it was healing.
The Building Bridges Foundation was formed in 2016 with the goal of bringing free horse therapy to veterans and their families.
Flies on you, huh? Getting about time for them flies.
Our founder, Dave Anderson, became involved with this. He had a relative who came home and committed suicide after his service, and so he's always had the idea of building bridges in mind.
Anderson donated 21 acres of land and 6 horses to the nonprofit.
Good girl. Yeah, good girl.
And it's easy to see Russell and Friendly formed an incredible bond, but he says it did take some time.
I wasn't real sure about it initially, but very quickly kind of assimilated with him. There was one in particular, his name's Friendly. We kind of touched off with each other, I guess, and he stuck with me a lot, and I'd call his name and he'd come to me. Friendly. Friendly.
Russell took part in weekly therapy sessions over the course of a couple of months to build up to that level of trust.
So it's a commitment in time, but it's a good payoff from what I understand from the vets who have been through the program.
And now he wants to share the program with other veterans who might be struggling to open up.
I think the biggest thing is changing from a sense of isolation and a sense of I'm carrying my problems myself to understanding that this is a location where they can come and freely express and get a handle on the issues that are bothering them.
I was there myself for years, and it's not a good thing. Come out of that shell, so to speak, and be part of the program.
Most recently, a Vets Cafe has been added to the grounds, and it's quickly expanding.
So between the equine therapy and the Vets Cafe, which is not really therapy, but it sure feels like it, I feel like I'm part of the family.
250 veterans have gone through the Building Bridges program. Again, all services are free to them and to their families. For more information, head to fox43.com. And if you have a bright idea for me, message me on social media. I'm Gabrielle Mediak.
What if medical treatment doesn't work for people? Sometimes one of the most powerful forms of treatment is the most natural.
They've tried treatments, they've tried therapy, they've tried medications that just don't work for them.
Focusing the body and mind. Coming up, how one South Central Pennsylvania gym is boosting the mental wellness of their clients through exercise. Mental health and fitness. Many don't realize that working the two together can actually aid in bettering your mental health. Fox 43's Allie Debicki takes us to one local gym where the trainer's focus is the mind and body of each client.
There we go. Breathe. Inhale, exhale. Fitness saved my life, and I just wanted to pay it forward. So I wanted to become a personal trainer. I just wanted to help people.
Helping people beat the struggle with mental health is the goal of Corey Allen and the staff with CFB Fitness and Nutrition. Thankfully, coping skills, community, and several other mood boosters are more attainable than may be realized.
They've tried treatments, they've tried therapy, they've tried medications that just don't work for them. This is a place where you can come in and you can work on mind, body, and spirit. That's the point.
The York facility is a safe haven for those who need support through group or one-on-one training. And Allen, the owner of CFB, understands as he experiences it himself.
For me, I struggle with depression. Having a place to be, having something to do, and people to be accountable to. I started out working out in a group, knowing that I would either miss out being with my friends or let them down because they depended on me or counted on me to be there.
Several other trainers and participants can attest to the life-changing power of working out.
When I joined here, I feel like my life in the last year literally is a complete 180. I'm happy, I'm confident, I'm growing patience with people and my kids. I feel like something was missing in my life.
I got sober June 9th, 2019, and I struggled with mental health issues for much of my life. It allows me to have a place to put my anger. It gives me a place to put all those emotions that I may not know how to regulate when I'm, on the outside and not in the gym.
The accountability is unmatched, and through the communication with the trainers, clients say they have been able to take back control.
If I see that people haven't been, I check in with them and say, hey, what's going on? Hope everything's okay. Not to program a workout, but as a support system as well.
A study from UPMC also says the emotional health benefits from consistent exercise alone include higher self-esteem or confidence, resilience, better sleep and memory, and less stress, which can lead to a better mental state.
So if you're feeling lost, you can find hope in a gym. You can find hope in a gym. You can find a place where you're gonna come across other people who know exactly how you feel and the things that you've been through. So don't give up. If you feel like there are no other options, this is one of these places that's an option.
Allie Debicki, Fox 43 News.
Thank you for joining us for this final part of our 4-part Silence the Stigma special. The one thing we hope that you got from this Mental Health Awareness Month is that there is always hope for a better future. Whether it's depression, anxiety, substance use disorder, or another mental illness, we have the information for a lot of resources that are local and available for you. It's on our website, fox43.com. All 4 parts of this special will be available on our website, as well as the Fox 43 Plus streaming app for Amazon Fire Stick and Roku devices. Thank you again for joining us, and good night.